Have you ever been told your blood tests look normal, but you still feel tired? This is especially common when you're over 40, when your energy starts to fade. And while fatigue can have many causes, one overlooked factor is what's happening inside your mitochondria, the parts of your cell that help you make energy. And that's where coenzyme Q10 comes in. CoQ10 helps your mitochondria produce ATP, the usable energy that your body runs on. Now, CoQ10 is not a magic fix. Poor sleep, low iron, thyroid issues, blood sugar problems, inflammation, medication, stress can all contribute to fatigue. But CoQ10 is often missed because it sits right at the center of cellular energy production and it's not checked on your standard blood test. I'm Michael Smith, naturopathic doctor, and in this video I'm going to explain why CoQ10 matters more after 40, what it actually does, why if you're taking statin medications it's even more important, and how to choose the right form, and who should be cautious about taking CoQ10. So CoQ10 stands for coenzyme Q10. You may also hear it get called ubiquinone or ubiquinol. And it gets those names because it's found everywhere in the body. It's present in virtually every cell. But it's especially important in the organs and tissues that use a lot of energy, like the heart, liver, kidneys, and muscles. And that helps you understand why it's so important in the body. Your body just doesn't magically create energy. It has to convert the food you eat and the oxygen you breathe into ATP. ATP is the main currency your cells use. And a lot of that ATP is produced inside your mitochondria. And coenzyme Q10 plays a key role in that process. Inside the mitochondria, there is something called the electron transport chain. You don't need to know the full biochemistry. The simple version is this. CoQ10 helps move the electrons through the energy production system, so your cells can make ATP more efficiently. Think of your mitochondria like tiny energy factories inside of your cells. You can eat well, get enough protein, and bring all the raw materials your body needs, but your cells still have to convert those raw materials into usable energy. And that usable energy is called ATP. And CoQ10 is one of the key compounds that helps with that conversion. So if your CoQ10 levels are lower, it does not mean the cells stop making energy. It means the system just may not run efficiently as it used to. And that can show up as low energy, poor exercise tolerance, muscle fatigue, or just that feeling that you don't have the same energy or getting older. CoQ10 also acts as a fat-soluble antioxidant. That means it helps to protect the cell membranes and mitochondria from oxidative stress. So it has two important roles. It helps with making energy, and it helps with protecting the very structures involved in the energy production. And this is one of the main reasons that CoQ10 is often discussed with healthy aging, heart health, muscle function, and mitochondria support. So why does it matter more after you're 40? And the main reason is your body makes CoQ10 naturally, but that production does not stay the same forever. CoQ10 production appears to peak early in adulthood, and then it gradually declines as we get older. By your 40s, 50s, and 60s, levels in key tissues, especially tissues with high energy demand like the heart and muscles, may be lower than they were in your 20s and 30s. A lot of people think that you're just getting older and that's why you have low energy after 40. And it's more complicated than that. It could be a number of things causing this. Things like sleep apnea, low iron, low thyroid, insulin resistance, chronic inflammation, poor recovery, or high stress levels. And while these are all things you want to try and identify and rule out, but one of the most overlooked things is that your cells are not making energy as efficiently as they used to. And CoQ10 is one of the main nutrients involved in that cellular energy production, along with B vitamins and certain minerals. And while food does contain CoQ10, you can get it from oily fish, organ meats, some nuts, but the amounts are usually small and not therapeutic levels. So if you're over 40, dealing with fatigue, have cardiovascular issues, or you just want to prevent heart issues, food alone may not be enough to make meaningful changes to your coenzyme Q10 levels. Now there's one group of people where CoQ10 is especially important, and that is if you're taking statin medications. Statins are commonly prescribed to lower cholesterol, and they work by blocking an enzyme called HMG-CoA reductase. This enzyme is part of the mevalonate pathway, which helps your body make cholesterol. But here's the part that many people don't realize, is that same pathway is also involved in making CoQ10. So when a statin reduces cholesterol production, it can also reduce your CoQ10 levels. Now, I want to emphasize that this does not mean statins are bad. And while they are often overprescribed, they can be helpful for some people. Especially if you have high levels of atherosclerosis, statins can be very important medications. But if you're taking a statin, it makes sense, especially if you're getting more muscle pain, low energy, that you also take a good form of coenzyme Q10. And the research on CoQ10 improving statin-related muscle symptoms is mixed. Some studies show benefit, others are less convincing, but it's definitely worth trying and seeing if it works for you. CoQ10 is very safe, and for many people, when they use the right dose and the right form, they get good results. Now let's talk about who else may benefit. And if you're not taking statins, other people who may benefit from CoQ10 is if you're over 40 and just having lower energy levels, especially if you're doing all the right things. You're getting good sleep, you're eating enough protein, your iron levels are fine, thyroid's good. But if you still feel flat or have that low resilience and not as good as you used to be, this could be a case where you try 200, 300 milligrams of CoQ10. Also, if you have cardiovascular concerns, the heart is one of the most energy demanding organs in the body. It never gets to rest, it's always working. So it makes sense that CoQ10 has been studied a lot with heart health and heart failure, and some of the research is very positive, particularly if people with well-established heart disease, or if you have a family history and you just want to prevent heart disease. It does not mean that everyone with heart disease should be taking it, and if you're on many different medications, you want to check with your doctor first. Also, if you're experiencing a lot of migraines, CoQ10 has been studied for migraine prevention. Often at doses around 300 milligrams a day. So it's not an instant pain reliever, it's more something to take on a daily basis to prevent you from getting migraines in the first place. This is because migraine research has linked mitochondrial energy support to migraines. Also, if you're getting a lot of high oxidative stress, chronic illnesses, or have high physical demands or poor recovery, CoQ10 can be part of the story. Now, there are two main types of coenzyme Q10, ubiquinone and ubiquinol. And these are two forms of CoQ10. Ubiquinone is the oxidized form. Ubiquinol is the reduced active antioxidant form. And they're not completely different compounds. They are the same molecule cycling between the two forms. Think of it as like a rechargeable battery. Ubiquinol is like the charged form. Ubiquinone is like the discharged form. And your body can convert between them. The problem is that this conversion becomes less efficient as we age, or if you have chronic illnesses, lots of oxidative stress. So if you're younger, healthy, taking the ubiquinone form may be just fine. And that's also the cheaper form. But if you're over 40, or you're taking statins, or if you have cardiovascular concerns, significant fatigue, I would prefer to take the ubiquinol form. It's a little bit more expensive, but it works better because the body doesn't have to convert it into that active form. Now, the best dose can depend on what you're trying to take CoQ10 for. For most people, around 100 and 200 milligrams a day is a good starting dose. If you're on statins, you might want to increase this to around 200 to 300 milligrams a day, especially if you're getting muscle pain, fatigue, or reduced exercise tolerance. For migraine prevention, the dose is around 300 milligrams a day, divided across two different dosages. And for fertility support, higher doses are sometimes helpful, somewhere in around 200 to 400 milligrams a day. That's more individualized and should be guided by your practitioner. One thing to remember is that CoQ10 is a fat-soluble nutrient, so don't take it on an empty stomach or just with water. To get the best results, you want to take it with a meal that contains fat, or even just a little bit of fat like some olive oil. For many people, taking with their largest meal of the day is the simplest option. And because CoQ10 is often helps you feel energized, I usually prefer to take it earlier in the day rather than in the evening or just before bed. Now let's talk about who should be cautious about taking CoQ10. It has a very good safety record, so most people can just take it without a problem. The main issue is if someone's taking medications like warfarin. CoQ10 has the ability to reduce warfarin's anticoagulant effect, and that's not what you'd want. So if you take warfarin, always check with your doctor before you start taking any supplement. And if you have complex health conditions on multiple medications, you may want to check with your doctor also. Not because it's dangerous, and they may not even understand what coenzyme Q10 does, but it's always good to let them know what you're doing. And the quality matters a lot. A lot of coenzyme Q10 supplements are underdosed or poorly absorbed. So if you're taking a cheap 30 to 50 milligram capsule, you're not going to get the same results or therapeutic dose. I would look for the ubiquinol form in at least 100 milligrams per capsule. Ideally an oil-based soft gel or an enhanced absorption formula. And get it from a reputable brand with good manufacturing processes. So let's quickly summarize before I talk about how you can actually get your coenzyme Q10 levels checked. CoQ10 is not the only reason why you can have fatigue after 40. It's not the magic fix, but it can definitely help. Always check the basics like sleep, iron, thyroid, B12 levels, medications, hormones, but CoQ10 is often an overlooked factor. And if you're over 40 and you feel like your energy is not what it used to be, it may be worth trying 100 to 200 milligrams of CoQ10 a day in the ubiquinol form. Because CoQ10 helps your mitochondria make ATP, which is the usable form of energy that your cells run on. And secondly, CoQ10 levels decline as we age, and it's an important antioxidant to protect our cells. And CoQ10 has an excellent safety record, so it's a good medication just to trial. One test that I use to check coenzyme Q10 levels is the Vibrant Wellness Nutrient Zoomer test. This tests all of your vitamins, minerals, and key nutrients like CoQ10. It's the most advanced nutrient test that I've seen, and it can help to take out the guesswork of not just whether you need to take coenzyme Q10, but whether you're deficient in other nutrients also. And have you ever had a blood test and everything comes back perfect, but you're still tired? Has coenzyme Q10 worked for you? Let me know in the comments, and watch this video next on nutrient absorption. Poor nutrient absorption will not only affect CoQ10 levels, but your overall levels of B vitamins, fat-soluble vitamins, and minerals.